I've had a lot of patients recently come to me with a diagnosis of rosacea, which is something that I really don't know much about. So this blog post was very helpful to me, and hopefully I can help some of you if you think you have rosacea. So rosacea is characterized by redness in the skin, usually in the cheeks, nose, chin, and forehead. Insert pictures here. So rosacea is a chronic skin disorder. It has no known cause, and it really has no cure either. Treatments are based on the symptoms and kind of controlling them. It's also characterized by flare-ups and remissions. So it can be kind of hard to get a diagnosis. There's no test that you can do to show that you have rosacea. And if you are in a remission phase, and it takes 6 months to get in to see your dermatologist, you might not have the clear signs of rosacea. There are 4 subtypes of rosacea, and you can have more than one subtype at the same time. Facial redness, if you're presenting with facial redness, you are going to be treated with skincare, a good skincare regimen for rosacea, and also IPLs and lasers. So IPL is an intense pulse light, and I've had it done many times for my pigment, which obviously I don't have anymore because it works. But it can be it feels kind of like a snapping rubber band, but it works great, and it's just a heat. But bumps and pimples, where people think that they have acne and they try treating the rosacea symptoms with acne meds, you can actually make your rosacea a lot worse. So you don't want to be using harsh things like salicylic acids or retinols, which prior to, I thought retinol was good for everyone. Turns out it's not. You can use topical steroids or oral antibiotics for the bumps and pimples. And again, that needs to be prescribed by a dermatologist. Oh, not steroids. No steroids. Stay away from steroids. So skin thickening, a good example of this would be Bill Clinton. We all know Bill Clinton's nose. That's an example of rosacea and skin thickening. Skin thickening can be controlled with some medications, but sometimes you do need surgery to fix this. So that's why it's also very important to control your symptoms as soon as possible, so make sure you see that dermatologist. So one of the patients that I had who was telling me that they had rosacea told me that she had rosacea in her eye, and I had never heard of this before, but apparently, as I learned from rosacea.org, you can have rosacea in your eye, and it is the 4th subtype, and it is characterized by eye irritation. And things that you can be prescribed are eye drops and also some antibiotics. So if you have eye irritation, those are the treatments. Treatment is crucial. You want to make sure you see a dermatologist if you think you have rosacea. It does progressively get worse if you do not treat it. And it is also, I was reading about it, and it reminded me a lot of acne patients. It's hard to go out in public, it's embarrassing, people look at you, and even harder than acne, because acne, I think you can have like a definite diagnosis. With rosacea, it can be kind of hard to get that diagnosis, especially where you're going through periods of remission and flare-ups. When you don't know what's going on with your skin, and you maybe haven't seen a dermatologist yet, or you just can't figure it out. A very good fact from rosacea.org was 78% of Americans have never heard of rosacea, and it affects millions of people. So a lot of people haven't even heard of this skin disorder. And so key facts. You want to make sure you see a dermatologist, like I already went over, and you need to know your triggers. And I recommend doing this before your appointment with your dermatologist. It can sometimes be hard and expensive and time-consuming to be seeing a lot of doctors, especially when you don't know what it is that you have. So it can be very helpful to write a diary of your flare-ups and remissions, including rosacea. And getting on a good skincare regimen. One of the reasons you want to see your dermatologist is so that they can help you get on a good skincare plan. There's a lot of products that you need to avoid. that most people think that they would be great for something with sensitive skin. And again, I already talked about acneic products, so I'm going to go more over skincare products as well. But there are so many things you need to be careful of when you have rosacea. It's definitely a very difficult skin diagnosis. There are so many possible triggers for rosacea, I couldn't fit them all onto my whiteboard. So I'm going to put a link to rosacea.org, which has a list, which you should look at. Remember, if you are going to be seeing a dermatologist, it's good to have kind of an idea of what your triggers are. So a journal is always a good idea. Lifestyle, foods, literally a million of them. Big one is red wine, so take up vodka. Temperature, so extremely hot situations like saunas or hot baths, you want to avoid those. Weather, sun, wind, extreme heat, those can all trigger rosacea. Drugs, you want to be careful of corticosteroids. Emotional, easy, just avoid all stress and anxiety-provoking situations. So as you can see, I filled my entire whiteboard with information about skincare and rosacea. The big thing that you want to remember is you want to use the fewest possible skincare products, and you want to make sure that they have a short ingredient list. A lot of things can trigger rosacea, as we just discussed, and that's one of the reasons you want to avoid all natural products. Usually these have a very long ingredient list and can contain a lot of factors that could possibly irritate your skin. So again, short ingredient list. When it comes to cleansers, usually a gentle or mild cleanser. Usually these are non-foaming, so they're not going to suds up. They're creamy cleansers. You want to make sure you're using a lot of moisture. If you thicken the lipid layer of your skin, it's going to be a better barrier against environmental stressors. A good thing for women, use a makeup that has a silicone in it. It's a light silicone base, and that will prevent you from drying out your skin with a heavy makeup, and it will also protect you more from the sun. With moisturizers, you want to check your ingredient list for something called propylene glycol. So this is a preservative that causes stinging, and it's also a preservative that's used in a lot of our foods, I think. I was watching a documentary about the foods that we eat and how really gross it is. So stay away from preservatives, do Botox. The most common skincare product that a dermatologist is going to prescribe for you is Metrogel. Counterintuitively, I'm not sure why, but gel-based products are usually very drying, and like I just said, you want to moisturize when you have rosacea. So I've had a lot of clients that told me that they were using it and it dried out their skin and they decided they didn't want to use it anymore. This is a product that you need to use if you're prescribed for it. So I told my patients that, use less, use a small amount, and kind of gradually work your skin up to it. My opinion, which again, I'm not a doctor, is that it's better to be using small doses than not using a product at all that you need. I understand a lot of these products have side effects that nobody likes. Again, dryness being one, a lot of acne medications like retinol cause redness and irritation. But if you use things in small doses and your skin kind of acclimates to it, it's going to be less harsh and you are using the medications that you need. So in my opinion, more important than not using, but again, not a doctor, just a nurse. So things that you want to avoid, pretty much everything. So no toners. Toners are out anyways. No retinols, the one skincare disorder where you do not want to use a retinol. No astringent, alcohol, witch hazel, peppermint, eucalyptus oil, clove oil, and salicylic acid. Avoid AHAs, alpha hydroxy acids. Avoid waterproof and heavy makeup. So usually waterproof and heavy makeups are very drying to the skin. Again, you want to moisturize a lot when you have rosacea. Oh, I almost forgot this again. Vitamin C. So vitamin C has known antioxidant properties, which means that it decreases free radicals in the skin and in the body, which play a major role in inflaming rosacea patients when they are exposed to the sun. So but the formulation of this product is really important. So different, I don't know if you guys remember biochemistry, but different formulations of molecules can penetrate cell membranes, and other formulations of them can't. So you want to make sure it's an L-ascorbic acid and not the other kind, which I don't know what it is. How you look can really affect how you feel about yourself, and having a skincare disorder like rosacea, you want to make sure that you do take care of it. This does not have to control you. There are treatment options. You just need to take the first step and see a dermatologist, get on a good skincare program, and avoid your stressors.